When it comes to treating ROCD, the effectiveness of a psychological treatment specific to ROCD hasn't been widely tested because, as I said, it's a relatively new research base. However, increasing research that has been done and also clinical attention does suggest that the current protocols for treating OCD in general are also effective in treating ROCD. So that will be CBT, Cognitive Behavioural Therapy, and Exposure Response Therapy, that's ERP. And I'll explain those both a bit more. So according to current ROCD research, CBT should firstly include assessment and information gathering. So this includes monitoring of the client's obsessions and compulsions. And this is to give the client and the therapist a solid understanding of the client's symptoms. This will later help the therapist and the client to identify ways to reduce the performance of compulsions and also the performance of avoidance and safety behaviours specific to that client's ROCD. So after this process of kind of information gathering, the next step in CBT is psychoeducation. And this is where the therapist educates the client about the disorder. Now, psychoeducation is really important for CBT, for OCD in general, but it's been specifically highlighted as essential in ROCD because of the lack of knowledge in the general population about ROCD, and this subtype of OCD. So that's really, really important. And then during this psychoeducation process, the client will learn more about their OCD, about how their obsessions and compulsions kind of create a cycle of doubt, and how it negatively impacts their life and their relationships as well. And this will then aid the therapist and the client to identify together what thinking patterns and beliefs about relationships and about love are distorted by the individual's ROCD. So that's a really important step, that psychoeducation step. And then the next step in CBT is, for ROCD specifically, is for the client and the therapist to collaboratively kind of challenge these maladaptive beliefs about love and relationships with more accurate and realistic thoughts. They don't have to be kind of more positive thoughts, they just have to be more accurate and realistic. And this allows for the kind of restructuring of their maladaptive beliefs through behavioural experiments. And this is where ERP comes into things, exposure and response prevention. And this is done with a view of reducing compulsive behaviours. Exposure and response prevention and the behavioural experiments involved in it are thought to be very, very useful in challenging the maladaptive thoughts associated with ROCD. So in ERP, the therapist gradually generates a situation that will trigger obsessions, and they encourage the individual to stay within that situation, that anxiety-inducing situation, and that's the exposure part of ERP. They expose them to this anxiety-inducing situation, they have to stay in it, and they have to do that without resorting to compulsions to reduce the anxiety, and that's the response prevention part of ERP, is the stopping of the compulsions. Now, this helps to highlight to the client that their intrusive thoughts, their obsessions may come and go, but they don't actually have to do anything to get rid of them. And the exposure situations that the therapist will generate will be different for each person because it depends on their specific ROCD symptoms, what their obsessions are, what their compulsions are. But I'll give a few examples of some common ERP exercises that are involved specific to ROCD. So I have a few examples here. So one example would be to thinking back about looking at your life and realizing you did make a mistake and you stayed with the wrong person for your whole life. But at the end of the day, you have to reflect in that situation on how you have to realize that there isn't much that we can do to prevent making mistakes. So that's one ERP exercise that can be anxiety inducing for those especially who have obsessions about not being with the one. Or being in the wrong relationship. Another example would be specifically for perceived flaws, so the partner-focused symptoms. That would be to carry around a particularly unflattering photograph of your partner and look at it throughout the day. That would be another ERP exercise, but that would be kind of more specific to partner-focused symptoms surrounding attractiveness, potentially. And then another example would be to express feelings of love and commitment to the partner via texts, via calls, notes, or just in conversation as well. So that ERP exercise would be particularly good for those who have avoidant compulsions, as I mentioned earlier in the video. So someone who avoids kind of expressing intimacy verbally or physically. So that would be an ERP exercise to put them in that anxiety-inducing situation by making them express love. And then a kind of final example would be to watch a romantic movie with your partner or just yourself, and not allow the anxiety about not having a passionate enough relationship. Watching a romantic movie and allow the anxiety to be there about not having a passionate enough relationship without trying to get rid of it. So just sitting with the thought like, oh, my relationship isn't as passionate as that, and just not trying to get rid of it, not trying to change anything about it, just sitting in that anxiety-inducing situation. So that's some examples of some ERP exercises. And as I mentioned before, all of these exercises will be accompanied by a response prevention. So stopping that client from performing their compulsions. And it encourages the client to learn to kind of face the anxiety caused by the exercise without having to do compulsions, to alleviate it. And in this context, it helps the clients to realise that their fears, while they're real, they're not realistic, and they're not as... So for some other treatment suggestions, some clinicians have suggested that in the specific case of ROCD, it may be useful to have the partner present or involve them in therapy if consent is gained from the client, of course. So in such cases, the partner's response to ROCD symptoms should be assessed and monitored. The ROCD psychoeducation should be provided to the partner as well as the client, and also ways of reducing kind of maladaptive behaviours should also be suggested to the partner as well as the client. And it's just important to remember that the goal of therapy isn't to save the relationship, it's to reduce the ROCD symptoms of the client. So that should be the aim of including the partner, not to save the relationship. And if you're looking for a more medical intervention than therapy, it's important to note that no specific research has looked into kind of medication for ROCD. There's no studies investigating the effectiveness of medication for ROCD. However, that some clinical kind of experience shows that SSRIs that are useful in treating OCD can also be helpful in... So I hope that this video has helped illuminate the complex nature of ROCD a little bit further by outlining the causes, the symptoms and the treatment suggestions. So to conclude, the main problem kind of surrounding ROCD is its ability to negatively impact someone's daily life and also their ability to form kind of and maintain healthy, committed relationships. And I just want to reiterate again that the purpose of therapy for ROCD is not to save the relationship. It's instead to facilitate enough symptom reduction to allow that person to make decisions of their relationship based on their true feelings rather than their fears that are related to their ROCD. So that's the main focus of therapy, is symptom reduction, and just to improve their daily life and their enjoyability of it. So I hope this video has helped once again, and if you do want to do some more research, like I said, definitely look into Guidoron, and he's doing some incredible things as well. And if you do feel like you're struggling with some ROCD symptoms, please do reach out to Private Therapy Clinic. We can offer you a free initial consultation, and we can go from there. But thanks everyone for listening, and I hope this has helped.